Hello friends, how are you? This is Dr. Nagi, Ayurveda and medicine doctor and also Isha Hatha Yoga teacher. So today in this video I am going to talk about the pre-diagnostic signs and symptoms for kidney disease. Regarding kidney disease, many times this happen, like people suddenly get into shock, like our kidneys stopped working, or we went to hospital and just doctor said, okay, your kidney is landing into failure, or do something about it, or you should go for dialysis, or sometimes they ask for certain precautions. But in Ayurveda there is a concept called Purva Roop, or early diagnostic symptoms of kidney disease. Purva means pre and Roop means the signs and symptoms. If you are well aware of pre-diagnostic sign and symptoms of kidney or the alarming signs for kidney which need early diagnosis so that you can protect your kidneys from major diseases. So in this video I will tell you certain very common signs and symptoms which you can feel by yourself and you can make the kidney health better, or at least go to hospital at the very early stage of kidney disease, so that no need kidney transplant, no need some kind of dialysis, and your kidneys will be recovered naturally and properly. In kidney, or if you say urinary system, there can be many things where disease can happen, like there are ureters, there are kidneys, there are nephrons, there is urethra, and like various organs are attached when we talk about excretory system or renal examination. Many other things comes. More details are needed for medical students, not for general people. For general people, there are certain signs and symptoms. If you pay attention, you can save your kidneys well in time. So let's see what Ayurveda has to speak about it. And I feel like everybody should be aware of these sign and symptoms so that they will not invite any kind of problem in their life, and they take timely precautions so that no problem happen in their health and well-being. So first and foremost thing regarding it is, if you feel any kind of puffiness in this area, under eye puffiness, you must have seen in many people they have puffy eyes. So when I say puffy eyes, puffiness means some kind of swelling, this area, under eye area, it is swollen. If you are feeling this puffiness under your eyes, and if you also have some other symptoms associated with it, like polyuria, means if you are going to for urination again and again very often, in half hour 2 times or once in half hour, and at the same time you are feeling there is puffiness under your eyes, that means it is time that you visit your doctor and do your renal functioning test. That is the test that is required to check the functioning of kidney. And if RFT, that is renal functioning test, is coming to be normal, then this puffiness may be because of certain other reason. But if it becomes little bit altered, then your doctor or nephrologist will guide you what need to be done. So this is the early thing which happens, and many people don't notice it because it is not a very prominent sign. It is very mild here, puffiness happens. So all those people who feel like they have this sign of little bit puffiness, they can go and visit their laboratories and go for RFTs, that is renal functioning tests. It's a very simple test, and it's a group of tests, and this is to check whether your kidneys are healthy or not. Next thing which you need to notice, for many people this happens, this is called haematuria, or the blood in urine, or urine is mixed with blood. So if this symptom happen to you, don't ignore it. At the same time, don't get scared of it. Like, no need to get scared, oh my god, blood in urine, what happens? It is just one of the sign and symptom that you should also not ignore. If this is happening, that means also you need to visit your nephrologist. And this blood in urine happens because of many reasons. Sometimes stones, sometimes your renal stones are there, they started moving, that time blood comes. Sometimes some renal cyst is, infection is, sometimes because of that it happens. But for all reason it can be totally curable. So no need to worry about it. You just visit your nephrologist or visit your doctor. He will tell you what to do. But at the same time, my purpose of telling you this symptom is, don't just sit in the home and get scared and not go to the doctor. It is the time that you visit doctor, because if this symptom is happening, it's quite normal, and you go, he will diagnose properly either with ultrasound or certain tests, and either with palpation, and he will let you know what is the problem. So no need to worry, but at the same time don't ignore this symptom. Next symptom or next observation which you need to observe, or patients mostly observe, if there is some kind of swelling in the feet. So if there is some kind of swelling in the feet and you are just thinking it is because of, we don't know why, there is no pain but there is swelling, and when you put thumb in it, there is a dip happens, like something just like a dip happens on the skin. So if this thing is happening, there can be many reasons there can be many reasons for this, but one of the reasons is it can be related with your kidneys or renal problem. So in these cases also, don't go for self medication. Okay, I have this swelling, that means I have kidney disease. Self medication, I never advise self medication, because self medication can be more harmful. Please note this line, more harmful than anything else. So it is always better, like, you take the advice of those people who know best in this field, because the people who have given 10-12 years to this field only, they are specialized in it, and believe me, they know better than you. So it is very important, if you are feeling this kind of sign and symptom, you visit your doctor, but at the same time visit some trustworthy doctor. Not like in every field there is adulteration, whether it's medical field, spiritual field, or any field in the world, there is adulteration. So make sure, like, you first inquire properly to which doctor you are going, and accordingly you take treatment. Believe me, there are good people in the world, and they want to do good for their patients, and they want to serve patients, but it is just you need to choose consciously. At the same time, I again want to tell you, don't just ignore this swelling. It is not something dangerous. In cardiac patients also sometimes this kind of swelling comes, but mostly on the, like, this is your feet, on the top surface of feet, if you feel this kind of swelling, it is better you visit your nephrologist or even internal medicine doctor. If you go, if there is no nephrologist, you go to internal medicine doctor, he will guide you what to do about it. Next very important thing regarding early diagnosis of any kidney disease is back pain, or the pain at the renal angle. So I will turn back, you just see where is renal angle. So this area, you know, here, this area. So this is the area. If you feel pain over here, this is the position of our kidneys. It is just below your rib cage. If you are feeling pain in this area, that means it may be because of kidney problem. Sometimes it is also muscular pain out of weakness. So both pains look similar, but there is another thing which, if it is pain is there, but and also there is some burning micturation, that is you feel burning sensation in urine. So this or polyuria, that is again and again you are going for urination. So these both symptoms are very much related, and this pain may be because of kidney. So if you have this pain and also some sign and symptom associated with it, please visit your nearby doctor so that he can guide you very well. So these are the few things which you need to pay attention regarding kidneys. In addition to that, sometimes, many times, severe shooting pain happens. Just you are sitting and sometimes very excessive shooting pain happen when the stone gets stuck in the ureter. So if this thing happen, either you have nearby a doctor, or you are already diagnosed with renal calculi, he knows what to do. Or if you are already diagnosed with renal calculi, you also know what to do. But don't get scared, but don't take it just lightly. Rush to the hospital. This is an emergency situation whenever some renal stone gets stuck in your ureter, that is the pipe. Ureter is just a thin pipe from which urine flows from kidney to bladder. So sometimes what happens, stone gets stuck into it, because in ureter there are 9 various curves are there, why to tell total very specifically, but there are various curves. In these angles, sometimes stone gets stuck and it causes pain, and suddenly patient gets scared, like what's happening. So no need to worry about it also. If you're feeling like these kind of symptoms, like again and again you are going for urination, and sometimes burning urination is there, like burning sensation happening while passing urine, or scanty urine, like urine is not passing at all. So these kind of things if happening, so it is the time that you visit your nephrologist or urinologist or internal medicine doctor. So these are the 3 doctors that you should visit if you have any kind of these symptoms. So I hope you will like this video, and these are the all things not to scare you, but if you pay attention to these things, your kidneys will not land into problem. And even if you visited your urinologist, nephrologist or internal medicine doctor and he has given you certain protocol, you need to follow that protocol. In addition to that, how Ayurveda can help you with all other things, like I mentioned, try to have your food on time, try to have freshly cooked food, try to consume it within 3 hours of cooking, try to have early dinners, and try to include fruits in your diet. But if your kidney is in very bad condition, then many citrus fruits are prohibited. So when you talking to your doctor, make sure to talk or ask this point, like whether you can have fruits or not, because many times patients forget to ask this question and they start eating fruits and then they damage their kidneys. So it's very, very important. If you have kidney problems, specifically ask your doctor like whether they can have citrus fruits or not. So this is very important point that I would like to mention, so that your health will be taken care of. So that's all for today's video. I hope you will like this video, and there are many other videos about diet, lifestyle, vata, pitta and kapha. There are various links below. You can go to our channel. Kidney patients can also do Sukha Kriya, pranayama, yoga. But yes, there are certain things, if your kidneys are in very bad health, then maybe certain kriyas are prohibited. But otherwise, general like sitting pranayams everybody can do, and Upa Yoga also you can do, except you don't have, you should not have hernia, then certain Upa Yogas are prohibited. So that's all for today's video. I hope you will like this video, and if you're watching me for the first time, there is a bell icon, there is a subscription button. Please click the bell icon, hit the subscription button, so that you stay in tune with our upcoming videos. Also, if you have any questions, please don't forget to write in comment section. We will try to answer your questions in the best possible way. Also, if you would like to support us, there is a join button near subscription button. You can click this join button and you can support us. Or if you want to have Ayurveda consultation with us, there are links given below in the description. So you can click on that links and you can write down to us, or you can write simply in comment section. We will let you know how to do it. So that's all for today's video. I hope you will like this video, and with this note I would like to say stay healthy, stay blessed, take care, and don't forget to share with your friends and family. Bye. Take care.